Welcome to EMTV's Infocus. I'm Bradley Valenaki. It's been over a year since the 2019 novel coronavirus first made its mark on the planet, a year since the World Health Organization declared it a global concern, and almost a year since the country's first known case. But there is good news in the world. The development of vaccines is giving hope to the world. While countries have received their first supply of vaccines for vaccination programs, PNG still waits for its turn. Will the COVID-19 vaccine help the country in its fight against COVID-19? And how soon will we see its rollout? But first, comments from the people. Are they willing enough to take the vaccines if it comes on shore?
Migen ksim lo marasin. Lo protect miet lo sick COVID-19.
Government talk by blacksim. Government. Mi plan ba nuna against government. Government talk mi plan ba action. Whether mi plan got sick or no got them by blacksim yet.
So tintin payment of women no kids la marasin.
Mi bachim la marasin because life lo important no staff. So if la marasin come to ba mi team lo protect miet lo la sick na panisi miet.
It will be the best idea to get this vaccine to Papua New Guinea.
Now, joining me in the studio to discuss the country's step towards the country's first COVID-19 vaccine rollout is Dr. Downey Esorom, National Incidents Manager from the Department of Health, and Dr. Deborah Dettels from WHO PNG. Thank you for coming on to the program.
Thank you, Bradley, and thank you for having us on the show.
Dr. Downey, first of all, where are we in terms of the COVID-19 vaccine rollout?
Thank you, Bradley. Before I go to the vaccine rollout and give the updates, I'd just like to give a snapshot of the country's situation at the moment. The cases you can see are probably from contrasting settings. In Sundown, we have the outbreak mostly at the hospital, where you have health workers and 4 of our specialist medical officers are currently in isolation. The others are nurses. Medang is a different situation. It's actually in the community. So the strategies and the response are probably going to be geared towards cutting this transmission. So we have a team at the moment from the Department of Health, from the National Coordinating Center, so WHO, who flew over today to Medang to help the team there. And we have another team going at the end of the week to Wanimo to actually help our team on the ground on the Sanaan province.
All right. So in terms of the vaccination rollout, when are we going to see this happening?
Thank you, Bradley. That's a very good question. PNG, we have a national rollout plan of which indicates the sort of, well, first and foremost, let me just say this, we need government approval. So we have now an NEC submission that is before the government to approve the vaccines. I will not comment on that because that's not officially approved yet. So when it gets approved, we will release the information. But yes, PNG at the end of December, around December 7th, we actually submitted the expression of interest to the COVAX facility, and it was accepted. We are just dealing with the I guess last part of the submission now, which is the indemnity part. So we have the minister and the Minister of Health and Treasurer to actually sign off. State Sol has actually approved it. So hopefully we can get the sign off quickly, and then we can, after government gives the approval, we can get the vaccines in.
All right. So you spoke about the COVAX facility and also PNG's request or intention to participate. WHO is leading this. What's the sort of advice that WHO is giving to us in Papua New Guinea in terms of vaccination?
Well, the COVAX facility is a group of international health partners. WHO is one. The others are Gavi and a group called CEFI. So the purpose of the COVAX facility is to facilitate provision of vaccines to countries that may be smaller or maybe not quite as wealthy, to give them potential access to vaccines in a timely manner. And so that they can introduce vaccines soon, at least soon after, without much delay, as the very first country to introduce vaccines. So we're a member of this group, you can say, one of the advisors, not the chief administrator, but an important advisor. And so we are, very much advocating that our, PNG government go ahead and use this facility to ensure that they can receive a safe and effective vaccine in a timely manner.
All right. So, Dr. Downey, you spoke of the proposal to have this vaccination on shore, and it's with government now. In terms of sourcing or going outside of the bureaucracy, has that also come to mind? There are other countries who have done that outside of COVAX.
Correct.
What about Papua New Guinea?
Yeah, there's a few venues where we can actually go through to actually access vaccine. One is the COVAX facility. The other one is to direct bilateral negotiations with countries. We are lucky in Papua New Guinea that Australia has actually come on board and committed to support us. So Australia will be one of the countries that we'll be working closely with to guide them as to what sort of the candidate vaccines that we should access. But a COVAX facility will actually provide PNG with 20% of the total cost of vaccines. The other 80% will actually be either made by government, bilateral partners, or other sources of support.
When we say 20%, how much in monetary value?
I cannot tell you the monetary value because, as I said, it depends on the candidate or the candidate vaccines that has been approved by government to be imported into the country. So that's work in progress. As soon as those figures come out, and as soon as we delve on the technical information that will be provided to us by WHO and the pharmaceutical companies, then we'll select the candidate vaccine or vaccines, and that will also include the cost.
All right. This is In Focus. We will be back with more on the other side. Welcome back to the program, PNG's COVID-19 vaccination rollout, discussions with the Department of Health and WHO PNG. Now, continuing on from our discussions, very interesting discussions, of course. In terms of the vaccines that we spoke about, the proposal now with government, what sort of requirements were actually put forward in terms of what vaccines we are bringing in? We understand cold storage is a concern
Yes.
In Papua New Guinea.
Thank you, Bradley. There's a few criteria that I would just want to highlight here that will guide us technically as to which sort of candidate vaccine or vaccines that we need in the country. I think the first and foremost important thing is that the vaccine needs to have the ability to actually stimulate antibody release in the body so that you can protect people or those people who are recipients of the vaccine to protect themselves against COVID-19. That's number one. Number two is the safety of the vaccine. Safety is very, very important. Efficacy, one of the key technical criteria that's being used globally and will be using. The other one is a profile of the side effects. When you give a vaccine, it needs to be safe. We don't want a lot of people to be reacting to a vaccine. That defeats the purpose of getting a vaccine. So we would want a vaccine that has a minimum side effect, both immediately, short-term and long-term. The other important thing is the vaccine needs to be affordable by the country. So we'll be looking at a cost-effective vaccine that we can afford, including support from our partners. But most importantly, as rightfully said, Bradley, our cold chain system in the country. We are looking at a vaccine that is able to be stored between 2 to 8 degrees. This is the sort of temperature where we currently store our vaccines in.
Okay, so currently there are at least 4 probably in the proposal. How many did you put forward to government?
We have not put any vaccines to government as yet. It's just an open submission to government to approve the vaccine. There's a lot of other criteria that I didn't highlight, but when the governments give the approval, we'll highlight them. It's not that easy because apart from government approval, we have to go through the Papua New Guinea regulatory body, which is the Department of Health. So it's not easy a process. We need to make sure we have checks and balances so that the regulatory body approves a vaccine or vaccine candidates that can actually prevent our people from getting COVID-19.
All right. So, Dr. Downey, many people are asking if the 10 million kina promised by government towards, vaccination, part of this, or is it separate?
That's a different proposal, Bradley. That's not part of the vaccine proposal. It's actually part of research, but it's unrelated to vaccine.
All right. So, WHO in Papua New Guinea, since last year, what's the sort of role now that you are taking?
We are supporting the government in the entire response to COVID-19 pandemic. One part of that is the vaccine. The other parts have been ongoing, things like surveillance, being able to track where and how many cases are happening, good case management, so for patients who do get sick, supporting the government to have available and use the most up-to-date and effective treatments. And then just logistics, it's very complex. Dr. Downey mentioned this with respect to the vaccines. It's not just vaccines that have to be moved efficiently. It's protective gear that healthcare workers use, and the community, needs to have access to face masks and hand sanitizers and a long list of things, oxygen tanks and, equipment to provide oxygen to patients that are very, very sick. So it's all of those things. We're just back behind the government, supporting them because it's a huge job. Yeah.
Okay. So, Dr. Downey, what's the sort of understanding now that you have of the people's willingness to accept these vaccines? Has there been any survey to better understand this?
Okay, Brady, let me just say this. COVID-19 vaccine is like any other vaccines. I think that's the most important thing that people need to understand. Mm-hmm. We've been rolling out vaccine and people have been accepting vaccine, the routine vaccines. We talk about polio, hepatitis B, pentavalent, all those routine vaccines. I would like to appeal to our people not to regard COVID-19 as another vaccine or special vaccine. No, it is a vaccine that can save the purpose of saving life, first and foremost. Number two, it's actually geared towards protecting people, but also saving the critical and the very ill ones. And most importantly, to prevent deaths. That for us is the most important thing. There's ongoing work globally to make sure that vaccine also protects the asymptomatic people. It's a new disease. A lot of work are going on at the moment so research will continue, and as soon as new evidence comes on board, new vaccines come on board, I'm pretty sure with the long line of vaccines are currently in clinical trials, we're going to have a lot of, I would say, arsenal to actually target COVID-19.
All right, you spoke of the vulnerable groups and the interest groups. What range are we going to give priority once we have the vaccines on shore?
Thank you, Bradley. That's a very intelligent question. If you see the current vaccine trials at the moment, they've been given to people 18 years and above, mostly. So for us in PNG, we've identified 4 main groups of people. The first one are the frontline workers, which also includes health workers. I did highlight the fact earlier on in our program that we have an outbreak that also affected a lot of health workers in West Nubitan, mainly in Kimbe Hospital and also Vanimo Hospital. So our frontline workers would be probably the first candidates to get it, also other social frontline workers. Number two, other people with other diseases or comorbidities, as we say. In Papua New Guinea, we have a lot of both infectious and non-infectious diseases, or non-communicable diseases, so to speak. They will also be candidates. Because of our age demography, population demography, people above 50 years will also be given the opportunity to get vaccine. We'll also be reserving some vaccines for emergency in the event that we are rolling out the vaccine and an emergency comes in where most of people are critically infected. They need to be safe. But let me just say this, it's optional. Nobody will be forced to access vaccine. But in the event that we have to give it in emergency, we have to give it basing on our assessment, expert advice, and also best guided by our national guidelines.
All right. This is In Focus. We will continue after this short break. Thank you for your company on In Focus, Dr. Dettels, continuing on from our discussions on vaccination. WHO state.
Okay, thank you very much, Bradley. I think one of the things I would like to emphasize is that the safety of the vaccine is of paramount interest and for WHO, just as it is for the government, as Dr. Downey said. And so one of the, to me, one of the main advantages of going through the COVAX facility is that they will only ship vaccines to countries after they've been carefully scrutinized by the WHO system. So to date, there's only the AstraZeneca vaccine and Pfizer vaccine have passed that very tough regulatory measure. So that, I think, I'd like for people to understand that. And then the other thing that I'd also like to pick up on what Dr. Downey has already stated is that this vaccine is, although a new vaccine against a new disease, it's been developed using the same trusted mechanisms that other vaccines that we've used for over 50 years have used. The process went a little bit faster than some previous vaccines because the whole world was afraid, actually, of this COVID pandemic, and they gave financial considerations to the pharmaceutical companies. There was also an expectation that instead of each pharmaceutical company or scientist protecting and hiding their data because they wanted to be the one who discovered, there was a sharing of data so that different groups could pick up on the work done by other groups in different countries, and it saved a lot of time in the development process. But the major steps that have to be gone through for a vaccine to be developed, those steps were all gone through, at least for the vaccines that have passed the regulatory process. So it starts, it's the vaccine process, it starts, in the laboratory. They look at the virus that we're trying to fight and see, where is that virus, a weak point of that virus? Where can we direct our vaccines to? That's the very, very first step. And then it may be given to animals and see, do they tolerate it fine? Only after those steps go well, then it can progress to where there are 3 levels of investigation using human trials. We call them clinical trials. And they're progressively involving larger and more diverse groups of people. And this was what has happened or is happening with the vaccines under development. And as Dr. Downey says, there are many vaccines, but some of them have gotten ahead in the process, and you've probably read about them, in the news or heard them on TV or radio. But those vaccines that have been widely approved, either the 2 from WHO, there are more that have been approved in various countries. Some by European regulatory agencies, some by United States. Just today, I think the Australian regulatory agency approved the AstraZeneca vaccine following the WHO approval yesterday. So These steps have not been skipped or gone over. So that is why we feel fairly confident in saying that the 3 or 4 vaccines that are being used by many countries are safe.
All right. So, Dr. Downey, there are many conspiracy theories around the country, and even the preachers are talking about it, saying it's the vaccine's a mark of the devil. What are your comments towards this?
Thank you, Bradley. That's a very good question. We are medical scientists, we are medical doctors. We are here to protect life. We swore on the earth to ethically protect life. We won't put people's life at risk. The global community is worried about this infection. It's spreading, and there are now new variants, as you probably might be aware of. So all of us is in the business of saving lives. Let me just say this. People have personal perceptions about the vaccine, but those personal perceptions should not influence the whole community, because the vaccines are here to protect the community. And as I said earlier on, COVID-19 is just like any vaccine. And as Deborah rightfully said, the development, the process of developing this vaccine or vaccines, is the same process that we've been developing vaccines. You talk about measles, polio, all those vaccines. Whilst I'm on the issue of these vaccines, let me just also highlight the fact here that although the focus is on COVID-19, I urge people not to forget about routine vaccines. We've got a low coverage of all our routine vaccines. You know very well in PNG, we had a polio outbreak not long ago. There's also sporadic measles and rubella cases. We've got whooping cough cases. Let's not forget our routine vaccines. Let's take COVID-19 as just a normal vaccine that will be routinized later. Once the governments approve it and the emergency use, it will become a routine vaccine that will be added to our national schedule. So that will be just like any other routine vaccines. So take it as a routine vaccine that is there to protect our people.
No. So what's the sort of next step that the department will take in terms of educating our people and bring them on to the same pace?
Thank you, Bradley. We have at the moment 8 clusters. I think Dr. Deborah briefly touched on that. The first cluster that we currently have in our emergency response plan is the incident management system. How we coordinate the different components of our response. We have the surveillance and rapid response cluster. We have infection prevention and control, the laboratory, logistics, partner coordination. We also have now added on 2 additional clusters, which is vaccine is one of them, as per the point of discussion here, and also innovation, technology, and research. So we have all these different, say, 10 clusters now. But our intention of COVID-19 here, COVID-19 has actually identified a lot of defects within the health system. Our intention of using COVID-19 in different clusters is actually to strengthen the health system. So people should see it as a way to actually strengthening the health system, so that once COVID-19 is normalized, at least we have a legacy. That yes, COVID-19 was a priority, but we did not only focus on COVID, we actually focused on strengthening the health system for all the other vaccines and everything else in the health system.
All right. Look, we've come to the end of our program, and we thank you very much for making time available on the program with us.
Thank you, Bradley, and we look forward to another show on your program.
All right, thank you very much. MTV's In Focus. If you have comments on tonight's discussion, you can get in touch with us on our Facebook page, and we are very happy to hear from you. See you same time next week. Bye-bye.